Acupuncture. Introduction. Acupuncture is considered part of complementary and alternative medicine. Select true or false. Correct. Researchers don't fully understand how acupuncture works. Studies are still being conducted to learn more about the benefits of acupuncture. Acupuncture is effective for everybody. Select true or false. Correct. Acupuncture doesn't lessen pain or other symptoms for everybody. There is evidence that people's attitudes about acupuncture can affect outcomes. Acupuncture is a completely safe treatment. Select true or false. Correct. It is mostly safe, but some complications have been reported. Acupuncture treatment may require multiple visits to a healthcare provider. Select true or false. Correct. Commonly, 6 to 12 treatments are needed to address a single complaint. These treatments are scheduled over a few months. Acupuncture is extremely painful. Select true or false. Correct. Although people experience acupuncture differently, most feel no or minimal pain as the needles are inserted. Not everyone will respond to acupuncture treatment. Select true or false. Correct. Some people do not respond to acupuncture. If symptoms don't improve within a few weeks, acupuncture may not be the right treatment for you. Thank you for using Explain.